This is Sarnia Lambton Daily for Wednesday, May 27th. Good evening, I'm Terry Doyle. The largest active COVID-19 outbreak in the area remains at Vision Nursing Home in Sarnia. Now the facility is getting more reinforcements. Blue Water Health has teamed up with the home and is now taking over certain aspects of the facility. They include infection prevention and control, personal protective equipment, environmental services, communications, and employee resilience. 15 Blue Water Health staff are working at Vision right now, such as registered practical nurses, personal support workers, dietary aides, and housekeepers. There are currently 9 residents of Vision who have COVID-19. Overall, 23 residents have tested positive, with 6 deaths. 20 staff have also tested positive since the outbreak began on April 23rd. Overall in Sarnia Lambton, 254 people have tested positive. That's up 3 from Tuesday's update, but 5 more people have recovered. That brings the number of active cases in the region to 48, 2 better than yesterday's update. On Tuesday, the provincial government released a troubling report on the conditions at 5 Toronto area long-term care homes that are being assisted by the Canadian military. The local medical officer of health hopes the report will force people to take another look at senior living in general.
I would also suggest that there is a larger question beyond just how nursing homes are run. And I think the larger question that I hope that this gives us a chance to examine is really how do we help our seniors and our elders age, in our communities? And long-term care is one part of that solution, but it's certainly not the only part. And I think that there's lots of learning that we can do to shape a better system that's not just the institutional system, but the whole kind of setup about how we look after our elderly and what supports and services they're provided and where those are delivered and how those are delivered. So I'm hoping, that this will push us into that kind of conversation. Like, I'm hoping it's not just limited to how do long-term care homes run.
Let's go to Lambton County headquarters in Wyoming. Jane Joris is the general manager of the long-term care division and joins me now. And Jane, let's talk about the situation locally. Lambton Meadowview Villa, the most recent outbreak with the 1 staff member, but I know that staff member has been away already for more than a week. So following all the protocols, I'm sure, and definitely hoping that indeed this is a case like the last one where it's one and done, I'm sure, when it comes to the outbreak.
Yes, that's right. We haven't really changed any precautions over the last 11 weeks. So not too much changes at the home once an outbreak is declared. But of course, people are anxious and we want to make sure that everyone's safe. So we do ensure that we don't admit any new residents during an outbreak. And we kind of increased surveillance, I guess I would say.
Jane, you talk about things not changing because, of course, rules and restrictions and following screening and everything has been in place so long, say, from when this outbreak started. For people not aware, what sort of things were put in place right from, go back to probably early March?
Yes, so in the beginning of March, we knew that something was coming. We didn't know what it would be, but we have a pandemic plan that's in place at all times, and we try and keep a week or 2 or more of PPE in place. We initially had to do passive screening, which is really just a poster, and people are reminded if they have any symptoms to stay out of the home. Then we did active screening. So we now have we have 1 entrance to each home open and a person there screening, asking about symptoms and signs of COVID, as well as taking temperatures when people come to the home, and only essential visitors can come to the home. So really that's staff or 1 family member if a resident is very ill. And we also screen people during their shift, not with taking temperatures, but just keeping an eye on people if they're getting symptoms. And then before people leave their shift, the person who tested positive at the home was identified as having some symptoms leaving their shift. So the screening works when done well. The other thing is we're assessing residents constantly for symptoms, and anyone who experiences symptoms, we put them into isolation immediately. And that means they stay in their room for meals, for care, for 14 days or until they get a negative test back.
Tell me about the cooperation and the collaboration that's gone on between the staff, residents, families, you name it. It's a stressful time for everyone, but I've got to think it's the key right now as everyone's been working together.
We've been really worried about psychosocial and emotional health of the people who live in our homes and their families. Some of them, the separation is probably the longest they've had in their lives. So we've worked very hard to make sure that we can do window visits, using technology, the telephone. We do have a number of residents who do have smartphones, so we're able to help them with that so they can keep in communication with their families. We have staff who have worked in different departments than they normally do, have had many changes to routine because of this. We're constantly retraining and auditing the use of PPE, and everybody helps out at mealtime. We've had to make sure that we have social distancing at mealtime. We've had to set up areas for people to dine in areas that they normally wouldn't be eating in, just because we want to make sure that we're social distancing and physical distancing at mealtime. So we've had to upstaff a little bit for that. And also high touch cleaning has had to increase. So we've had to have people doing that maybe that wasn't their main duty at the beginning of this, but they're doing it now. There's also we've redeployed from some staff from our adult day programs, which have been closed since March 13th, and also from cultural services in the county.
When we know that it's one person is declaring an outbreak, and as you said, that the way you do things stays the same. But I've got to think communication is so important as well. We're just letting residents, their families, and other staff know, just because it's such a stressful time, if they know what's going on, just to, I guess, set everybody's mind at ease as much as possible.
We've tried to do weekly communications with families, as well as set up a direct line in each home that they can call and leave questions, and someone will get back to them. The nurses are very busy, so answering the phone, we've tried to still provide people with that opportunity, but have the nurses not have to answer the phone as much. We have also implemented some email communication that we didn't used to do. We always phoned families, but we found that particularly when we're going into outbreak, because information comes out from public health, we want to make sure that we have our families notified before all that information gets out. So we implemented email communication. There were a few bumps at the beginning, but I think we've got that process down pat now.
Well, for a lot of people who do not have exposure to long-term care homes, this is a new thing. But planning for outbreaks, as you mentioned, pandemic planning, or even we see with other outbreaks, gastro or influenza, this happens. And I'm sure, while maybe this is ramped up a little more, it's a thing that the staff has been preparing for and is always working with 12 months a year.
Yes, we especially plan for flu season. So a respiratory outbreak like COVID-19 is similar to that, although this virus is working much differently than that. We have in each of our homes trained infection control practitioner. That's a nurse who's taken special courses through Ontario Public Health to be able to help with outbreaks and infection control in long-term care. At Lambton Meadowview Villa, we actually have 2 of those trained nurses, so that's been helpful. And what we did from the beginning of the pandemic was we made those positions full-time. They used to be nurses who worked full-time, but not always as the infection control practitioner. But now they're working full-time as the infection control practitioner to help us make sure that we've got all those precautions in place, and we're staying vigilant.
Jane, the report came out yesterday that the Premier announced regarding the 5 homes in the Greater Toronto area, and some troubling news coming out of there. As someone who works in long-term care, what came to mind when you saw those reports coming out of Toronto?
The reports are very sad, and COVID-19 has strained an already under-resourced, undervalued, and over-regulated sector. What I am concerned about is that there'll be another inquiry, another commission, and it will cost money and take time. And I think if the province listens to the sector, we can offer solutions. we're very lucky in the County of Lambton. We have long-term care ministry funding, and the County of Lambton also has invested a significant amount of money in our facilities, in our buildings, and in our care. We also have resources with HR department and IT department. So we're able to probably manage better than lots of areas in the province where the staffing crisis is unbelievable. We are constantly onboarding new staff, but we do not have the problems that they have in many areas of the province. I have heard of homes where 60% of their staff were away from the home when they went into outbreak. So these issues are exacerbated because of this pandemic, but the sector has needed help for a long time.
Yeah, definitely very much of a challenge in the sector. Does it help here locally that being under the Lambton County umbrella, you talked about staff with the Adult Day program, there is that collaboration, IT, HR, you name it, everyone can work together versus maybe in some other jurisdiction, a home may be off on its own a little bit?
Yes, that's true. And the resources that we have, all of our funding goes into care. The other thing is, I believe in Lambton County, we have, when we first went into outbreak at Lambton Meadowview Villa, I had phone calls and emails from all the other operators offering help. We've provided assistance to some when they were short on PPE. We have a group that helps each other out, and I think that has also assisted all of us in the area.
Jane, before we go, and you kind of led in a little bit where I was going, tell me about the positives and how people working together. We've seen in one home last week was arranging a parade for a 100th birthday and having people give wishes because, of course, visitors couldn't come in to wish happy birthday to this 100-year-old woman. Tell me about the positives that you're seeing with the staff and the residents.
So I think people have learned new skills. We've learned how to do things differently. People are open to change. The relationships are strong always when you're in a difficult situation and there's anxiety, and people support each other. I also think that we've been able to communicate with families maybe a little bit more on a one-to-one basis, because we're not doing a lot of big group activities, so we're assisting the residents to talk with families, and sometimes the staff are part of that. So some of that has grown. I think that there's been an appreciation in the province of the hard work we do and the complex needs that people have in long-term care.
No, it's definitely, we know there's a team working together and doing some great work here in Lambton County and throughout the area. Jane, we appreciate the time, take care, and all the best to you and the staff there.
Thank you very much. Stay safe.
There's Jane Joris, General Manager, Long-Term Care Division of Lambton County. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Welcome back to Sarnia Lambton Daily. Well, we know it has been a challenge throughout this pandemic for families and when it comes to childcare, especially for essential workers as they continue on the job but have to look out for things on the home front as well. Let's go to Melissa Fitzpatrick, who is manager for Lambton County when it comes to homelessness as well as children's services. And Melissa, take me back to when this all started, the challenges that were faced when it comes to childcare.
Well, thanks, Terry. I mean, back in the beginning, when the province came out with shutting down a lot of things, restaurants, schools, childcare was included back in the middle of March. Again, just so much unknown for the whole country and the whole world. So childcare was ordered to close. Of course, lots of essential worker families and still had work to go to and still needed childcare. So after a couple of weeks went by, the province did decide to allow childcare to open back up, but on a very limited basis and only for essential worker families.
And where are we now in terms of opening up some additional spaces?
So when that order came down originally, allowing emergency childcare, we ran with just WeWatch, our home childcare provider in Sarnia. The rationale being it's much smaller numbers. There are only 3 to 4 children per home. So we felt that was the safest option. But as time went by, the need kept growing, and we were successful with putting an application to the Ministry of Education to allow us to open up 2 center-based sites. However, it's not the full childcare. I think it's important for the public to realize that normally London Bridge, our Oak Ave site, runs at 88 children. We're open back up for 12 children. So it's 2 rooms of 6. So that's our first, that one opened up Monday, the 25th. And this coming Monday, June 1st, the YMCA on Finch Drive will be opening up 2 more classrooms. So 12 more children, 6 per room.
Obviously, yeah, big difference in terms of what the normal capacity would be versus what's happening there. Are you finding this is at least helping to alleviate even just smaller situations just for even some essential workers right now?
Yeah, it's certainly helping. And I mean, our message has been throughout all of this. We partnered, very closely with Lambton Public Health and taking our direction from Dr. Renaday. Wherever possible, we want children to stay home. The safest place for them is home in their own family bubble. Recognizing that's not always an option for some people who don't have family to help out or whatever, but yet they really need to go to work. There are essential workers. So it is helping. Our wait list continues to grow. It's about 14 children right now. So for the size of our municipality, it's not horrible. And we are continuing to engage with our childcare operators. We're going to keep trying to open up maybe even another one, but we're going to take it slow. We want to make sure that first and foremost, everybody is safe.
And what steps are being taken in the places that are open now, or of course will be opening next week, to maintain safety?
So again, I have to give credit to Lambton Public Health here. We took a lot of guidance from them. We developed quite a lengthy document, just a guideline to give to our childcare operators. As I said, this is also brand new to all of us. But some of the things in that document are, well, even the very low ratio, so no more than 6 children per room. We're keeping that to 2 to 3 families. So the kids would all be in the room together. So if they're siblings, we're not separating the children out by age. They're in one room. As well as the staffing, the early childhood educators are not floating between classrooms. They're staying in like a pod structure. So educators and children stay within their own room. We have daily screening. So when families arrive in the morning, the parents and children have a temperature check and a screening questionnaire, just to make sure there's no symptoms of illness. No visitors are allowed in the building at all. So parents are, they're just met at the foyer and they don't go into the childcare. Along with deliveries, everything's left at the door. So just trying to really minimize the number of people in the facility and doing our due diligence to screen and make sure that upon arrival the children and educators are healthy.
Is it a little bit of a difficult situation as well where, of course, you go into a hospital or you go in somewhere and personal protective equipment being worn everywhere? Well, for a child, that might be a little harder for them to see and understand and maybe even a little scary. Is that sort of something where safety comes first, but still having to weigh, the mind of the child a little bit?
Yeah, absolutely. I mean, we still want to encourage the early childhood education experience. We want to make sure those kids are feeling safe and nurtured and they're learning and growing. So the PPE is worn at screening, so at the screening end point, but once they're in the classrooms, educators are doing their best to maintain, social distancing, but we're not wearing PPE in the rooms at this point. That's not been the direction, that's not what's been required by Lambton Public Health.
When you go through this and parents, of course, reaching out saying they need help with childcare, looking at essential workers, has that been difficult? Because in some cases, especially when this first started, people like who was an essential worker was, of course, a massive list when that first came out. Did you find that was difficult just to sort of weave your way through that from obviously hospital workers, but so many other people working on the front lines?
Yeah, and it was a challenge. And keep in mind, the list changed a couple of times too, because it started off with, what we would call obvious, right? Just doctors and nurses and paramedics, personal support workers. But as time goes by, we realize, well, so are grocery store workers and pharmacy. So the list has grown a couple of times, which of course was a contributor to why the demand keeps growing. So, but we try to do our best and again, encourage people to keep their kids home where at all possible. And in partnership with us, we are trying to work with our public health and our operators to open up enough spaces to meet the demand.
Are you also hearing, and I think you may have touched on it a little bit before, but from people where in the past they may have been able to lean on, for example, a teenager that lives down the street or someone, or go to a neighbor's house or even to a grandparent's house or something like that, where right now really that's not an option?
Yeah, certainly we've seen some of that, especially with grandparents. I'd say that's probably been our most common feedback, is normally grandma and grandpa watch the child, but grandma and grandpa are older, and of course everybody's worried about each other's health, and people are trying to stay within their direct family unit. So yeah, that's definitely been part of the challenge.
Before we wrap this up, and let's keep it on a positive note, is tell me about the people who are the ones providing the child care, and obviously you know, they're in their own way being on the front lines of this.
They certainly are, and we commend them. I mean, they are putting their own health and safety at risk, right? They're front every day going to work, but they have passion and commitment to their profession, and we definitely give kudos and recognition to them, because without childcare, a lot of people couldn't go to work.
Well, appreciate the time, and certainly pass along our best wishes to everyone there, and keep up the good work. We'll check in with you again soon.
Okay, thanks, Terry.
There's Melissa Fitzpatrick, Manager of Homeless Prevention and Children's Services, joining us here to give us an update when it comes to childcare for essential workers, something we know has been certainly a challenge faced by many people during the pandemic. Stay tuned. You're watching Sarnia Lambton Daily on your TV. Welcome back. Recapping our top story tonight, Blue Water Health and Vision Nursing Home have announced the hospital is taking over certain aspects of Vision Nursing Home as it continues to deal with the COVID-19 outbreak. Infection prevention and control, personal protective equipment, environmental services, communications, and employee resilience will now all fall under the leadership of Blue Water Health. 6 residents of Vision have died since the outbreak began on April 23rd. Overall, 23 residents have tested positive. There are currently 9 active cases among residents. A total of 20 staff have tested positive. There are also current outbreaks at Lambton Meadowview Villa in Petrolia, Marshall Gowland Manor in Sarnia, and Village on the St. Clair on Front Street in Sarnia. Those last 2 homes, neither of them have had new cases since the outbreaks began on May 15th. Well, that's our show for tonight. Thank you so much for joining us. We will see you back here tomorrow.